my name is Amber Martinez, and I'll be validating for a central line dressing change. I washed my hands, provided the patient with privacy. I have the doctor's orders that it is okay to change it. I'm going to identify the patient, introduce myself. My name is Amber. We are going to be changing your central line dressing. While I do this, I would ask that you not touch the site and not touch the sterile field. I'm going to raise the bed to a comfortable working height. I'm going to ask while I'm raising the bed to a semi-Fowler's position, I'm going to ask the patient if there's any pain or anything bothering him about the central line. Everything's fine. I'm going to drape. Next, I am going to open up my central line kit. I'm going to use this as my waste receptacle here. I'm going to open and remove my gloves and mask. I'm going to then put my mask on. While I do that, since I don't have another mask, I'm going to ask the patient to look away from the wound. Help him. Next, I am going to put on my clean gloves. So I'm going to remove the old dressing. And then discard. I'm going to assess the area for any redness or irritation. Everything looks fine. Going to take off my gloves and discard. Next, I'm going to open up my sterile field. I'm going to open up my sterile gloves. To put on my sterile gloves. dispose of the trash receptacle. I'm going to assemble my area. Okay. I'm going to clean the site. Like this. Make sure it drains into the sponge. Going to clean the area for about 30 seconds, making sure I get all the edges. Making sure I get underneath one. Clean up central line and underneath, and discard. Going to allow the area to dry first before putting on my bio disc. Give it a second. My bio disc is placed on the area. I'm going to grab my transparent dressing. Hold it by the edges. Discard. Applying it in the center. Making sure it is firm and in place. Going to take this extra piece of tape here to keep everything else intact. Okay. After I see that everything is in place, I'm going to remove the bandage. Discard. I am going to date and put my initials and time. Place this on top of the dressing, making sure not to cover the transparent area or get it on the patient's skin. You can still see the wound in excess site. Next, I'm going to cover the patient. Tell him he could now turn his head. Very comfortable. I'm going to lower the bed. I'm going to then remove my gloves. And then my mask. I'm going to wash my hands. Document any findings in the I&O sheet, and dispose of any trash. And that's how you change a central line dressing.